It's simple. They either have a blood clot or they don't. That's what I love about venous ultrasound. You don't have to worry about a bunch of different types of pathology. This is how to perform a lower extremity venous exam, a normal exam. However, I will be going over how to avoid getting false positive results, as well as a few tips for tricky exams. Now, when you have a patient who has a lower extremity venous ultrasound, they should have indications like pain in the calf or their leg, swelling in their lower extremities, some tenderness and warmth in their leg, not coolness. But those are the typical symptoms of a deep venous thrombosis, which is what we're looking for, of course, during the lower extremity venous exam. I'm going to give you what I believe are the 3 keys to successfully performing lower extremity venous exams. Number 1, you need a proper understanding of anatomy and physiology. That's the foundation. You've got to have that. If you don't have that, you need to study in your book, or I do have some information in the circulatory skill set. Number 2, you need to perform proper compressions. I'll get into that later. And number 3, you can use the arteries as a guide to find the veins, as the arteries run alongside the deep veins. But do not image the arteries as the veins. I've seen that happen. That's not okay. Of course, every protocol is different. Definitely share with me what protocols you have experienced, and I'm going to share with you a protocol that I personally follow. When you perform these exams, you want to grab your linear probe. I usually use a 9 megahertz probe. Now, let's get into this protocol. First things first, you want to start with the patient in the frog leg position. Their knees slightly bent and their kneecap pointing outwards. So you can get to the inside of the leg. You want them to be supine position as flat as possible. Starting with the common femoral vein. First thing you need to do is make sure that you have access to that area by moving any fabric out of the way. You want to, I usually tuck in a towel or a washcloth, make sure I tuck that into their underwear so that's not in the way. And at first this was difficult for me because I felt like I was all up in their business, so to speak, but I have to remind myself this is medically necessary to ensure the health of the patient, so I have to get access to where I can see clearly the anatomy. Always look for the veins in transverse position. Don't search for them in longitudinal. Go transverse first, and then if you need to turn on the vessel, then you can turn. So you're going to start with the common femoral vein in transverse position. You're going to be high up in the groin, in the crease of the leg, as you can see in this image. This is where your transducer should be, and this arrow coincides to the direction that your notch of the transducer should be facing. So when you start imaging the common femoral vein, you should be superior to the saphenofemoral junction. Now I'll show you exactly how to do that in just a moment. Now, the common femoral vein is always medial to the common femoral artery. That's whether you're in the right leg or the left leg. The common femoral vein will be towards the inside of the leg, more towards the inside of the leg. Now, what are some other ways that you can tell the difference between the artery and the vein? The artery will have thicker walls, and it will not compress as easily as the veins do. The artery will also be pulsatile, so it will be jumping up and down a little bit, pulsating, whereas the veins shouldn't be pulsating so much, not in the lower extremity vein. Like I said, to start your compressions, you should be above the saphenofemoral junction, up here. Now we're going to see the difference in where you should be beginning your compressions. Here's the junction, here's above the junction. Junction, above the junction. Junction, above the junction. Above the junction is where you should start your compressions. Now, how do you know you are pressing hard enough on the vessel? Once the artery walls begin to collapse and the vein is still not compressing, that might be indicative of a deep venous thrombosis. if you have ruled out the other possibilities that we'll discuss later on. We're going to turn our transducer from transverse to longitudinal. We're going to take the rest of our images. You need to take a 2D image. Next, you want to put on color Doppler and make sure you have good color fill. It is important to have an angle, a little bit of an angle to the vessel that you are visualizing in longitudinal. So that means you will have to heel toe the probe so that you can make sure that the vessel is slanted on your screen so that you can get the maximum Doppler shift and your color Doppler will be able to fill up the vessel. Now you have to get a spectral Doppler image to demonstrate the quality of the blood flow. The blood flow should be spontaneous and phasic. So there should be just random flows of the blood flow, as well as it can be dependent on the breathing habits of the patient. When the patient exhales, as far as the lower extremity veins, then blood flow should increase back towards the heart. So you want to demonstrate that through your images. Many facilities require you to augment the vessels. So that means distal to the vessel you are visualizing, you will squeeze the leg and that will increase the blood flow. So if the common femoral vein, I would squeeze the leg at the mid-thigh. You have to squeeze on the inside of the leg where the vessels are. If you squeeze on the outside of the leg, nothing's going to happen. There's no deep veins right there. You have to squeeze on the inside of the leg. A lot of times I'll use the back of my hand if it's the inner thigh. Just lean in and push a little bit. You don't want to hammer into the patient like some people do. Now, the saphenofemoral junction. Here, back in transverse, you see here on the image, we have the common femoral vein with the little branch coming off the side. This branch always comes off the vein medially. So that means, depending on which leg you are visualizing, it will be on a different side of the screen. Keep that in mind, but we'll go over that later. So here we can see it coming off the right side of the screen while we are doing the right saphenofemoral junction. And then I have compressed the vein here. You can no longer see the vein, but you can still see the artery. Next we have the proximal femoral vein and the deep femoral vein. These I usually try to get in the same image if possible. So here we have the superficial femoral artery. There's the femoral vein. Here's the deep femoral vein and the deep or profunda femoris artery. So I try to compress these both at the same time. And here you see the superficial femoral artery and profunda femoris artery still in the compression picture, whereas the veins you should not be able to see. The femoral vein ends when the deep femoral vein joins that vein. So do not image, once it has joined, image inferior to that confluence. I will show you how now. Now in transverse, the common femoral vein looks like one circle. Once you get to the deep femoral and femoral vein, it looks like two circles. So you have common femoral, and once you're far enough, then you'll have two circles. The femoral vein and the deep femoral vein. Let's see what I'm talking about in this video clip. One circle, two circles. One circle, two circles. One circle, two circles. It's very important to make sure you are at the right location when you're doing this imaging. Now, when you turn into longitudinal on this vessel, just use a little bit of imagination here. You have to angle a little bit to get both of these vessels in the same image. We have the femoral vein, the proximal femoral vein, and the proximal portion of the deep femoral vein. Then you have color, and then pulse wave. I failed to mention, you do not need this angle correct. You do not need this angle correct that you see here in this image. My facility just requires that Why? I do not know, because venous flow is not angle dependent like the arteries. The femoral vein, which is more anterior, have demonstrating the normal phasic and spontaneous flow. We're augmenting. I usually would augment at the mid-thigh here. Demonstrate that. Next, we do the deep femoral vein and augment at the mid-thigh. You do have to augment a little harder for the deep femoral vein. For the mid-femoral vein, we're going to move inferiorly at the mid-thigh, here in transverse. So we see the femoral artery and the femoral vein. Again, if you ever get lost, try to follow the arteries. And if you completely lose the vein, always go up to the common femoral vein and then follow the veins back down. That's a good tip. If you ever get lost in your imaging, go back to the common femoral vein, where you start from where you know and then go try to follow what you don't know. Turn longitudinal. Here you see the mid-femoral artery and the mid-femoral vein in longitudinal. Remember to try to keep a slight angle on the vessels that you are visualizing. Take your color Doppler image, and then for the pulse wave, take that image and augment. For the mid, by the time I get to the mid-femoral vein, I will start augmenting in the calf, the medial calf. A little squeeze. Now for the distal femoral vein, this is a tricky spot because a lot of times you can stop seeing the vein as it dives in through the adductor canal, as you can see in this image. And also, compressions are difficult because it can be painful because of the location. So, what I will do, I was performing an exam on a person who worked in my field, and he kindly let me know, you don't have to press that hard, you should press behind the leg so that it doesn't hurt the patient as much. I was like, okay, thank you. But the tip works, so that's what I started doing. I compress the back of the leg so that I don't have to jam into the patient's leg just to compress the vein. So I'll compress with the probe and the back of the leg to close that vein. So here's the femoral artery, the femoral vein. This patient had an extra vein right here, and that will be called a bifid system. Here we see vein, artery, vein. You're going to take the color Doppler. You're going to take your pulse wave image and augment again in the calf, the medial calf. Then for the popliteal vein, here it's difficult to demonstrate or image exactly where you'll be, but you're going to be behind the calf in this area. You have to make sure that the patient definitely has their knee bent to help you get access to that area. Here's the popliteal artery and the popliteal vein. You're going to compress, and you can still see the artery here. The vein walls have coapted. And this is the patient positioning that you need for sure for examining the popliteal fossa. So this happens to be the left leg, but this is nonetheless position that you need. For the longitudinal image, make sure you keep an angle on the vessel. Fill the vessel with color Doppler, and then you'll take your pulse wave image and augment in the medial calf. I failed to mention, I do like to image the popliteal vein superior to the other veins that join to form the popliteal vein, superior to the gastrocnemius veins and saphenopopliteal junction. Some facilities require this and some do not. Imaging the gastrocnemius veins. You're going to move inferiorly in the popliteal fossa until you can see two sets of paired veins. It is not easy to see these veins when you're first starting out, but with practice you will see them. Here you can see one set, vein, artery, vein, and then another small set, vein, artery, and vein. It's hard to tell, I know. Lighting change. So the posterior tibial and peroneal veins. You want to use the tibial bone as a guide for the posterior tibial veins. So you're going to be medial to that tibial bone. That's the more anterior bone. You're going to be on the inside of that bone. I usually will start looking for the calf veins in the mid calf. I don't start all the way up here. You're never going to find them. Start mid or the distal calf to find them. But you want to make sure in any veins you are looking at, compress all the way down. From the common femoral down to the perineals. Compress at every few centimeters. Here I'm starting at the mid calf to check the posterior tibial, which is medial to the tibial bone, and then the perineal. Tip for locating the perineal veins, look anterior to the fibula here. You see this echogenic area with the shadowing? That is the fibula. Just anterior to that, you will usually find the perineal veins. So, perineal vein, perineal artery. Both of these sets of veins have an artery in the middle of them. Here's the perineal vein, perineal artery. Perineal vein, posterior tibial vein, posterior tibial artery, posterior tibial vein. So, I usually get these in the same image and compress them both. And here, you see I've compressed the vessels in this image. You cannot see the veins anymore. Tips for viewing the calf veins. A lot of people have a lot of trouble with this. Of course, I always search for the veins in transverse, but one thing you can do is put on color flow, augment distally here in the medial distal calf, and then you can see where the veins and arteries line up. And you can also just try to search for the artery. If all else fails, search for the artery. You can see it pulsating, and a lot of people will have, unfortunately, some calcifications on their arteries. So you can see where it's more bright in the walls of the arteries. Look for that, and then you'll find the vein. So some facilities will require you to visualize these veins in longitudinal. Of course, just turn very slowly to be able to stay on these vessels. Here's the posterior vein. So here's the second vein. Here's the color and pulse wave of these two posterior tibial veins. Remember, you have two veins, two posterior tibial veins, two perineal veins. Now, here I could get all three vessels in the same image for the perineal. So two perineal veins and then the perineal artery in the middle. Then use a little bit of augment sometimes to help fill the vessels with color. And then you get your pulse wave images of each vein. Now for the left leg, the left saphenofemoral junction. We're not going to go over the whole protocol for this, but you see here, GSV, the great saphenous vein, comes off medially on the left side of the image here, as opposed to the right side. So keep that in mind. It's not always going to come off on the exact same side of the image. If it does come off on the same side, you have your probe backwards and you need to straighten it. So here are the references for a few of the photos that I use, such as the diagram, very last ultrasound image. The majority of these images I scanned myself for. So thank you guys. Thank you for my contribution to society here. Now, tips and tricks. I've got a few. I mentioned false positives. I have seen some sonographers, they will see rouleau flow or sluggish flow in a vein, and they will say that that patient has a deep venous thrombosis. Rouleau flow is not the same as deep venous thrombosis. Rouleau flow means that red blood cells are clumping together, they're stacked together, and thus you can see the red blood cells in your 2D image. You can see them moving through the vessel slowly. That is not completely normal, but it's not a DVT. The ultimate way, the primary way to make sure whether there is or is not a deep venous thrombosis is through compressions. With rouleau flow, the vein will still compress completely. So that means that that patient, even though they have rouleau flow, they do not have DVT. That is one way to avoid a false positive. Another pitfall of sonographers is that sometimes they are not able to compress a vessel, and they assume that the patient has a deep venous thrombosis in that vessel. And in reality, sometimes the patient is holding their breath. If the patient is holding their breath, the veins will not compress, especially in the thigh or the groin. Some people are ticklish or sensitive in the groin, and they will be anticipating pain or anticipating discomfort, and they will tense up and hold their breath. This will prevent you from being able to compress the vein. You have to sometimes convince the patient to allow you to compress the vein. Within reason, of course. Sometimes you can just say, not able to be compressed due to patient intolerance. However, if you are able to coach them, I will usually get them to, while I'm getting my probe ready in position, to inhale, and then I'll ask them to exhale, and then I'll compress the vein before they know what's coming. If you are trying to demonstrate color flow Doppler and you're not able to get the vessel to fill with color, the patient could be holding their breath or taking very shallow breaths. So what you can do is ask the patient to take in a deep breath and let it out. Once they let it out, be ready to freeze that image so you can get your color Doppler image. And for larger patients with larger lower limbs, sometimes if the limb is so large, do not even start with the linear probe. Go ahead and grab the curved probe. You're going to need the curved probe to image certain areas. I usually narrow down my sector and decrease the depth significantly so I can get focused on my region of interest. When it comes to the femoral vein, meaning the mid and the deep femoral vein, I usually will start looking for the vessel with color Doppler. If I can't see the vein in 2D or follow it in 2D, I'll use color Doppler to locate the vein. Sometimes I can only locate the artery, and then I'll augment to get some color flow to know, okay, that's a vein. Then I'll take my compression images with and without color Doppler. If you found this video helpful at all, I hope I broke this down simply enough for you. Please give this video a thumbs up and comment what video you would like to see next. If you haven't already, check out this step-by-step carotid artery tutorial video. Thanks for watching, and I'll see you in the next video.